One of the first responders who made these sessions possible says he needed to act because he was tired of seeing his friends die after dealing with mental health issues.
Myself, as well as a friend of mine, was actively suicidal at the same time. I made it out and he didn't, and I knew something needed to be done.
6 months ago, flight paramedic Eddie Rice began working with Dr. Bill Warden, medical director of Heartland Medical Direction. Heartland provides education and training for 80 mostly rural agencies across the state. Now, thanks to a grant from the state, they're able to train a team of medics that can deploy across Oklahoma when a smaller agency might need someone for their staff to talk to about stress or trauma they themselves are experiencing.
If they don't take care of themselves, they're not going to be able to take care of everybody else like they want to.
Psychologist Kathy Thomas is with Warriors Rest Foundation, a nonprofit that uses peer support and crisis intervention training to teach first responders how to help their fellow paramedics, firefighters, officers, or dispatchers when they're struggling.
When we're teaching them about how to respond to people in crisis, it also is very eye-opening. People tend to realize, oh gosh, you know, I've experienced that, or I've had that, or I have that call or that incident that I never dealt with and that I've just been carrying around.
Luther firefighter Fawn Tibbetts took part in the training, something she believes is crucial.
I think it was a fossil for a while. It was something that was buried and people didn't really talk about it. And now it's being exposed because we are mankind. We are humans.
And those conversations, no matter how small, can make a difference.